Good evening and welcome. My name is Janice Adelzo, and I'm a writer and editor on the marketing and communications team at Partners in Health. Thank you for tuning into our event today. Today marks the first ever Mental Health Action Day. It's a movement of thousands of nonprofits, government agencies, and leading brands who are working to turn mental health awareness into action. This evening, we'll discuss the intersection of mental health and racism with our panelists whose work stretches across medicine, tech, and entertainment. During the COVID-19 pandemic, the challenges we all face in our daily lives have been exacerbated, and the mental health of individuals and communities across the globe have been negatively impacted. At PIH, we recognize the importance of mental health, including self-care and getting treatment for diagnosed mental illnesses. Mental health is a broad spectrum, and during this event, we'd specifically like to focus on how it intersects with racism and trauma. During the next 40 minutes or so, we'll examine how health and our society at large are permeated with inequalities and learn about how to prioritize mental health during this time of much needed healing. Before I introduce our panelists, I want to quickly acknowledge that several hours ago, President Joe Biden signed the COVID-19 Hate Crimes Act. It's intended to help speed up the review of hate crimes against the Asian American and Pacific Islander, or AAPI, community. I now have the great honor to introduce our talented group of panelists. Dr. Sacred Kelly, who is PIH's cross-site mental health psychotherapy technical advisor. Welcome, Dr. Kelly. Dr. Mary Yang, who is a psychiatry consultant for PIH Liberia. Welcome, Dr. Yang. Eric Nam, who is a multifaceted singer, songwriter, entrepreneur, and mental health advocate. Welcome, Eric. And last, but certainly not least, Tracy Chou, founder and CEO of Block Party, whose mission is to make people feel empowered online and protect themselves from social media bullying and abuse. Welcome, Tracy. We'll have the opportunity to hear from all of our panelists tonight, but this first question I'd like to direct at you, Eric. So the impact of racism that racism has on individuals in the United States is really like an invisible cancer for communities of color. Yet seeking mental health services remains stigmatized. Can you comment on the ways in which systemic racism has an impact on mental health, especially for the AAPI community and the Black community, and also how the COVID-19 pandemic exacerbated that reality?
Yeah, thank you for the question. It's a pleasure to be here and an honor to be a part of this conversation, which I think is so timely for everybody around the world. I guess, in terms of my response, it's probably just best to speak from my personal experience. But I think when we look at the systemic racism and the impact on mental health for Asian Americans, I think there's a perception that Asians are quiet, we're subservient, we live with this myth of the model minority, and we're also the perpetual foreigner. So traditionally, and even to this day, I think we've never been fully seen as American. There's always a hyphen or a qualifier that has to justify why we are here. And I think this is something that consistently underlines the Asian American experience, particularly living in the States. And I think that the problem with this is it can seem very minor or innocuous to some, and living with these misconceptions from a young age in some way forces us to accept that microaggressions or systemic racism in whatever form it appears to us is harmless, or that it is okay, when it very much is not. And I think because of this perception that we're also like this perpetual foreigner, we're often told to just suck it up or not cause a scene, and that we should be grateful to be here as immigrants or as children of immigrants. And that in turn forces Asian and Asian Americans to internalize and normalize racism that is forced upon us from a systemic level. And now I think when that happens, it creates a situation where if we come across an issue such as racism, we may naturally tend to shy away from direct confrontation. And I think for me, like I've had situations where I question, am I allowed to be vocally against it? Am I allowed to say something against it? Because it goes against how many of us were raised to be appreciative of the fact that we're even here. So am I overreacting? Am I being overly sensitive? I think those are the questions that we automatically lead to. And it kind of talks us out of raising the issue because traditionally we were never asked if this was a problem or if we even have a problem with this. Now, I think having a situation where we have normalized internally systemic racism, it's obviously not a healthy mindset. So there are so many mental health issues that can stem from it. And I think the other issue that kind of is always lingering is that because many of us internalize these issues, we are not very used to expressing it. We're not very used to asking for help, seeking counseling. And for many Asian Americans, it can be something that's very, very difficult to do, and it's become very stigmatized. And I think, through COVID-19, it may have become exacerbated or even worse because you look at I guess, how do we say this? The extremes of the racism that have been in the systemic process that we've lived in. Obviously, COVID-19 has been difficult for everybody mentally, emotionally, but Asian Americans, we have been hit in just so many ways. AAPI businesses were some of the most hardest hit and most affected, particularly because of the rhetoric that framed COVID at the start, aka the China virus or Kung flu. These, though they seem to some funny, they have had incredibly negative and literally violent effects on the AAPI community. There's been a direct correlation of the rise in hate and violence against AAPI members with the usage of these terms. And I wonder sometimes if the stereotypes that people have, even if they're just kind of, under the surface of us being a model minority or nice or passive and weak in some ways, allows for people to carry out hate crimes or target Asian and Asian Americans even more without fear of reprimand or consequence. And so I think because of the rise of hate crimes, because of the fact that we may not be historically well equipped to deal with mental health issues, when we have all these things coming together, I think we all right now as AAPI, particularly in the States, we live with heightened anxiety, stress, paranoia, and probably a slew of issues that are stemming from this. We feel attacked, we feel unsafe, and I think it's all really been exacerbated by COVID-19. Sorry, that was a very long response.
Thank you so much, Eric. Thank you for touching both on your personal experience and for acknowledging that, it may seem minor, but for the people experiencing it, it certainly is not minor. Now, Dr. Kelly, I would love to pull you into the conversation. Can you please comment on ways systemic racism has an impact on mental health?
Sure. Systemic racism is something that is quite violent and traumatizing. And I want to put a period at the end of that. It is something that is embedded in every aspect of our society and culture, from where we live, to the food we eat, to the quality of healthcare we have, to the education we receive, to the resources that we have access to. So, I don't want to make it seem like it's this hidden thing, right? It's working very much in the forefront of society and in everybody's lives, and it's a constant presence that's there. So, with that, we at times can become a product of our environment and society. And I would like to bring up Frantz Fanon, whose work that I often look to when working with marginalized people, but he essentially believed that the psyche can be directly impacted by the political situation in which we live and we were born into, right? And that is often something that has historically been ignored by the medical community and the mental health community. So stigmatization of mental health services didn't happen quite in a vacuum, as we would like to think that, that there was this paranoia essentially and fear of doctors and psychologists and psychiatrists. It didn't happen in a vacuum, and it didn't come out of nowhere. A long time in this country, medical practices and mental health practices have been largely racist and have done a lot of harm to communities of color. So it makes sense that there is a stigmatization with regards to mental health as well. And many times, it's difficult to differentiate between what a person is feeling and what they're experiencing. So, I think that it's important to recognize that the stigmatization of mental health as a practice and as a profession has been largely developed out of past historically racist practices within the field of medicine and mental health. I would also like to say that, communities of color have largely been affected by COVID-19 due to the societal difficulties that they experience and are challenged with. As I said previously that, there have been historically racist practices, but I think, within there have been several research studies to show and to illustrate the prejudices and biases of medical practitioners currently practicing, right, that may have also contributed to the large death rates of people of color when infected with COVID-19. Additionally, there weren't enough testing centers, right? So that also exacerbated the effects of COVID-19 within communities of color. Also, many times people of color are the frontline workers, right, or essential workers. And so they have exposure to COVID-19. So all of these societal factors really contributed to the exacerbation of the discrepancy in the mental health system and medical system in terms of the services that were received by people of color, which made them a lot more vulnerable and susceptible to contracting and dying from the disease as well.
Thank you, Dr. Kelly, and thank you for going in depth about how, the social determinants of health, many of which you mentioned, have an impact. Now, Tracy, I would like to pull you in as well. And if you could please specifically comment on the ways that you've seen systemic racism translate specifically into online hate on social media.
Sure. I guess the first thing I would say is what happens online is really not that different from what happens offline. And particularly during this pandemic, everything is online. All of our interactions with people, work, personal life. So everything is online. The harassment we're seeing online reflects the same patterns of bias and hate, misogyny, racism that are pervasive through the rest of society. And online harassment is no less real because it's online. And the impact on people's mental health is absolutely very real and significant. And in fact, what is different about the digital platforms and being online and worse is that they enable things to happen at a different scale. Consumer web scale is what people like to talk about, which is good when you want lots of users, bad when it's all negative things coming at you. And one analogy I think about a lot is actually, I've experienced anti-Asian hate on the street, people yelling things at me like, go back to Beijing, but it's not at the scale of what happens online, where I've easily gotten hundreds of those kinds of comments in an evening. And each of those little comments can be painful to hear. And I know the feeling I get when somebody harasses me on the street, just one bad comment. But when it comes in a flood and it's hundreds or thousands of these things piling on, even just having to see this is really painful in terms of the mental health impact. I feel I'm lucky in that I'm not so high profile, but still enough to experience this. It can be so extreme for anybody who gets targeted for saying the wrong thing, tweeting on the wrong hashtag, someone who just happens to go viral. Like the amount of hate that can come in is absolutely unreal. And during this pandemic, when we're all online, like there's, even more online behavior and also a lot more people who are frustrated and taking out their negativity on other folks on the internet. So I personally felt quite a lot of this mental health impact and had to take a step back and think about how do I minimize the trauma to myself of having to see all these negative comments. Sometimes people will say like, well, if it's so bad, then just get offline. And that's just not really a solution when we all live online. Social media is a fact of life for all of us. For many people, it's a professional requirement to be online. And so going offline comes at a very, very high cost. But I guess the first thing is just kind of realizing like how real online harassment is, online hate, how much of manifestation of, I don't even want to say offline, but just like general societal issues it is. And so all this that we're talking about in terms of racism, like it just translates into really severe harassment and hate that we experience in digital forms as well.
Thank you, Tracy. And thank you for acknowledging that it's, not easy just to get offline. Many of us, it is a professional requirement, and we can't just delete our social media. Many people who I'm sure are tuning in today found out about this event through social media. So it's just not that easy to unplug as much as many of us would like to. Now, Dr. Yang, I would love to invite you into the conversation if you'd like to add any thoughts or comments about the ways systemic racism has an impact on mental health.
I agree with what everyone has said. So I'm actually based in Canada, where, I think the country's perception of racism is that it's not an issue, it's been dealt with, it's an American thing. And I think that there's often like a lot of comparison that like, at least it's not as bad as there, which really just serves to minimize the realities of like people living here, that there are like really big discrepancies. And, in many ways people talk about COVID, like revealing like what really has been here all along in terms of systemic racism and inequities and harassment that people have to live with.
Thank you for sharing, Dr. Yang. This next question, Dr. Kelly, if you can answer first. So, globally, we think of how colonialism and the transatlantic slave trade left a lasting impact across every societal structure. How has that legacy manifested in the mental health of communities living under those dual shadows?
Right. Well, I am personally of the belief that we are all living under this shadow, and it causes us a great deal of psychic harm for everyone. I just want to remind people that, James Baldwin and philosophers or psychiatrists like Fanon often spoke about the subjugation of people being necessary to maintain white supremacy, right? So, in other words, we all have internalized the notion that in order to have or to be in power, there needs to be oppression that happens, right? And that no one can really ever live without or exist without this oppression, that, it's normalized in a way. And I just feel that this creates this sense that, in order for certain people to be in power, or for anyone or individual to be in power, that there must be a subjugation of another person, right? And that this is often done in a very non-critical way, right? It doesn't leave us to really think about the ways in which we oppress others or contribute to the dehumanization of other people, populations, individuals, right? So I think that it can be really helpful if we really stop to think critically about the socio-political structures in which we live, respond to, and support, right? And I think that we could also see this as a way to resist, in a lot of ways, oppression or an oppressive state within ourselves and in our society. But I also think that this is a way to humanize yourself and others around you, right? Because if we don't think critically about oppression or subjugation, then we are bound to dehumanize others typically and minimize our own sense of humanity. And so within my own practice as a psychologist, I really like to work upon the principles and practices of liberation psychology, which was largely developed by, wasn't necessarily developed, but it was enhanced by Martin Barrow, who was a Spanish-born priest and psychologist that worked in El Salvador. And essentially what he said was that there needs to be a development of a critical consciousness, right? So we need to develop a critical consciousness. And that essentially means is that you can hold a sense of love and peace in your heart, but also be very critical of the society in which you live, right? And we need to recognize the interconnectedness between our lives and the social political context in which we live, right? And again, all of this is to develop a sense of rehumanization of yourself and society. But then I also take it a step further. I think that there needs to also be kind of a denormalization, right, of mainstream society, in which we do have this dichotomy of love and oppression, or power and oppression, essentially, and that, you know, oppressed people that are oppressed tend to thrive when they're within their own society and culture. And so I assist people to help them look for things in their culture and society that embrace their own sense of humanity, and therefore the humanity of others. So I would say that it could be helpful if others could do this in their practice, right? Not just marginalized people, because like I said, we are all affected by colonialization and the transatlantic slave trade.
Thank you, Dr. Kelly, and thank you especially for what really resonated with me was that denormalization of, you know, mainstream society. Now, Dr. Yang, I'd love to pull you in here as well and hear your thoughts.
Yeah, you know, I think many thinkers, much smarter than me, have summarized racism as all about money. The transatlantic slave trade, the taking of North America from the indigenous people that lived here, like mostly racism is about money. It's other things too. Many ways, it really comes down to money. So I think we see that in the type of services that are considered essential health services. And it's only really in the last 10, 20 years that mental health has been considered an important enough service for that should be recognized and treated around the world. I think that there has been like such a large body of research to show that the risk of psychosis and certain mental health condition are pretty directly correlated with experiences of racism. There are many studies, several very well done studies that in Ontario show that people who are Black who immigrate to Canada are at much higher risk of developing schizophrenia and psychosis than people coming from other countries. And I think it's fair to say that there really is a correlation with racism. So I think when we talk about the legacy of the mental health of these communities, money, I think, determines a lot of the social determinants of health, which affect mental health in the same way that they would affect physical health. It affects how much access people have to resources. I echo what Eric said about therapy, like in many communities, being seen as a thing that white people do, a thing that Woody Allen does, and like definitely not for you, is a self-indulgent thing, instead of something that is actually really important to acknowledge and to work on, and to receive support for. Yeah, so my summary is that I think it comes back to money. money helps to buffer from life stresses. When you don't have enough access to money, the systemic wealth gap leaves you more vulnerable. People are often at higher risk, and money also leaves you with less access to receiving treatment for these conditions. And I think this is as true in North America as it is in Liberia and many of the other communities where PIH works.
Thank you, Dr. Yang. It's still sort of mind-blowing to me how only in the past, 20 years that mental health services have been seen as, an important enough service. Eric and Tracy, would either or both of you like to add any thoughts in?
One thing I'd like to add, speaking from the perspective of an Asian American, is the sort of complexity of dealing with race issues as an Asian, where there is some proximity to whiteness and this idea, the myth of the model minority, where especially in the industry that I work in, which is tech, and Asians are overrepresented in tech, we're kind of held up as having made it. We are very well represented, at least in the engineering ranks, maybe not so much in executive ranks, but we are present. And tech is considered a wealthy industry. And so it feels like Asians have made it and we have a lot of privilege. And this idea of the model minority of Asians who are able to succeed by dint of their work ethic. It really is an anti-Black racist tool that's meant to sever communities of color and pit Asians against Black people. So there's still all of that white supremacy underlying all of these conversations. So there's the privilege on the one hand that we have as Asians, but then also the exclusion we still face. And obviously during this pandemic, we've seen a lot of that manifestation of the anti-Asian hate that is still there and quite prevalent. So kind of straddling that duality of privilege and exclusion is quite difficult. And I think it does also lead to a lot of these mental health issues where we feel like we should be grateful for the position that we have in society, but at the same time, we are still being targeted and killed by mass shooters. So there's that trickiness. To comment also a little bit on colonialism, so this is perhaps different than the colonialism of the transatlantic slave trade, but there's also colonialism in Asia, and the legacy of colonialism in Asia still persists. And I think there's a tendency to sometimes try to flatten the AAPI community and consider all Asians as the same, whereas we're not the same. We come from different home countries that had different experiences of colonialism, like back home. My family is from Taiwan, which was under Japanese colonial rule for some time. The Japanese colonized a lot of Asia. There's a lot of Southeast Asian countries that have the legacy of colonialism that they're still dealing with as well. And within the Asian community, we often perpetuate racism as well, whether it's East Asians towards Southeast Asians or South Asians. And everything is very intersectional as well. So there's classism and other forms of misogyny, all these other forms of bias that kind of get interlaced. So it is quite complex. It's a different form of racism we have to deal with as Asians than what Black people will have to deal with. I think it's all of us, and seeing the Black Lives Matter protests and seeing George Floyd, that's a very different type of racism that we've had to contend with in America and globally than what Asians deal with, but the complexity of it doesn't make it any easier to grapple with.
Oh, yeah. So, to kind of take off of what Tracy was mentioning about exclusion, I think is something I wanted to just briefly touch on. I think in tech, yes, there are, a lot of Asian Americans in this space, particularly in engineering. But I think on the flip side, if you think of, places where we are excluded, I think that's what perhaps I could speak a little bit to, just being and working in media and entertainment. There were a couple studies that came out this week that kind of looked at films from 2007 to 2019. And some of the figures and the statistics in it were actually quite jarring to me. They looked at 1,300 of the top films from that time period. And of those 1,300, only 44 had an API lead or co-lead. And of those 44 films with an Asian lead or co-lead, 14 of them were Dwayne "The Rock" Johnson, who I absolutely love, but I think it really speaks to the lack of visibility, representation in the space. I think we just need a lot more inclusion and for us to be lifted up and for people to help pull us up. I think we've been asking for help across all different industries and sectors, and we've been wanting to feel empowered and to empower others as well. But, you know, how do we get to a point where we can do it naturally and it's consistent? We don't have to keep talking about this, but until we get to that point, whenever that may be, we have to keep talking about it. We have to keep bringing it up. I think the other part that I want to kind of touch on is the fact that this is still on the exclusion part, but I moved to Korea 2011, so almost exactly 10 years ago. And once I started to do music in both the US and Korea, a lot of the interviews, a lot of the press was always like, why did you go to Korea? Why didn't you start here? And to me, it just felt like it was such a funny question, because I was like, when have you seen anybody that looks like me on the Grammys or at the Billboard Music Awards or on MTV? Growing up, I never saw that person. I had this conversation last night. I still remember the first time I saw an Asian comedian on TV. It floored me. It was Margaret Cho sometime in the 90s. And I was like, oh my gosh, there's an Asian person on TV. And for people who aren't of the minority, you're like, oh, what's the big deal? But if you are not able to see yourself in a position of power or of influence or whatever it is, you're not allowed to dream or to imagine what you're able of accomplishing or becoming or fulfilling. And I think that is another thing that is very systemic that we have to actively fight against and fight for in terms of representation. So for me, it's always been, if I could have started my career 10, 12 years earlier at just out of the States in what I consider my mother language of English, then yeah, maybe things would have been completely different. But that was never a realistic option for me. I went to Korea, and for this, I'm forever grateful and so thankful that I had this opportunity. But there, because I'm not of the minority, it didn't matter that I was Asian. It was like, can you sing? Can you perform? And it was based on my ability and my skill set as an entertainer, instead of, oh, but he's Asian, so we don't know what box to put him into. Can he sell records, or is mass America going to be okay with an Asian kid singing a pop song? So I think this is an area that we are still incredibly excluded from. And though we have had a lot of strides and a lot of movement towards building for visibility and inclusion, I still don't feel like we're anywhere near where we need to be and where we can be and where we should be. So I think this is all just kind of ties in with the systemic parts of it, as well as the inclusion, exclusion, the stereotypes. Obviously, this topic is so vast and so complex, but I just did want to add, from my experience, my 2 cents on that.
Thank you, Eric, for sharing your personal experience. I have another question for you as well. Resiliency is this weighted term, and we often use it to describe marginalized communities and their ability, to just keep going despite the crushing realities, which you just mentioned. So can you talk about how you have engaged with that term, both, personally and professionally? And what advice would you give to, the people who are listening to this, who are struggling to maintain their own mental health in the face of systemic racism?
Man, that's a loaded question, because it's hard. I think the first thing that we have to accept and we have to completely embrace is the fact that it's hard. And even if somebody says, oh, there's a way to simplify it or make it easier, it's all relative. And if it's the biggest, most challenging thing for you personally, anything I say is not, I don't think, going to help you. But I just want to, I guess, encourage whoever may be going through difficult times to really reach out for help and not be afraid of it. And if you're in a place when you're very blessed in the sense that you don't feel this need to be resilient, then you are privileged, so privileged that you can help other people who may be feeling that. So I think this is something that is a two-way street. If you're struggling, ask for help. If you're not struggling, look to help somebody. And that's just, I think, a general word of encouragement that I'd like to give to anybody who's listening. And I think the other thing that we have to acknowledge is that being resilient is tough, because for a lot of people who have not had the struggle of really going day by day or going up, and even for me, I recognize that I come from a place of privilege, so I will not have had the same need or experience in needing to be resilient, but it is something that cannot be discounted. It is something that can completely affect things beyond just like your day-to-day. It's just like your psyche, everything about who you are and the way you speak or the way you react to certain situations. It is a burden that can consume everything that you're doing. And so for people who are like, oh, what are you talking about? Resiliency, blah, blah. It is something that until you've experienced it, you do not know. And if you are in it, it can be incredibly paralyzing. So everybody should have a little bit of grace. Everybody should have a little bit more of an openness and open mind to really reach out, reach across the borders, and to kind of encourage each other to kind of lift each other up. And so I don't know if that's particularly helpful, but I think that's like the only thing I can do. Send some good vibes into the universe and really encourage people who are watching to be a part of this change that we need as a society and as a world.
Thank you, Eric. Yes, we absolutely all need to lift each other up a bit more. And Tracy, I want to pull you in and would like to hear your thoughts about, how you've engaged with the term resiliency, both professionally and personally. And if you could talk a little bit more too about your work with Block Party and how, the advice you'd give for those struggling to maintain their own mental health.
Yeah, personally and professionally, I have felt like I have needed to channel as much resiliency as I can, like day by day. On the personal front, speaking to an earlier topic of conversation, online harassment, I deal with quite a bit of online harassment on a very persistent basis, and have done so for like a decade or more. And it's gotten so awful and persistent. I've had to go to the police multiple times. I have to be constantly in some fear of like physical stalking and those kinds of issues. And it goes all the way down to just like the more casual harassment that I get online. And there have been points where I've wanted to just collapse in a corner and cry. And I've done that as well, to just break down because the harassment can get so terrible. And on the professional side, working as a startup founder, and I am specifically working on trying to solve this problem of online harassment with my company, Block Party. It is also really frustrating to experience the sexism and racism of the tech industry, to know how much harder it is as a woman to raise money. For example, like in 2020, 2% of all venture capital money went to female founders. Like 2% of all the investment going into tech startups went to female founders. So I know it's a super rigged game, and it permeates all aspects of trying to build my company. It's the same with like talking to investors who don't understand that online harassment is a very big problem, and they'll try to gaslight and tell me that, I'm kind of imagining how big the problem is, that I'm creating a problem where one doesn't exist. And all of this is very frustrating, but I guess the flip of it, like the way I kind of turn it around, is I think about how I can express my agency and trying to do something about this. And I was doing a lot more research around online harassment and talking to folks who have had to deal with this problem. It can be very frustrating because it feels like there's nothing you can do when somebody is trying to attack you online and being very persistent about it, and the platforms won't do anything. You can't report them. Our current legal systems don't make it very possible for you to do much except in extreme cases. And so it can feel very paralyzing because there's nothing you can do. I'm in the very fortunate position that I can actually channel my skills and experiences and networks to try to do something about this and build a company that can actually try to address this problem and use technology, which is something that I know, to try to make things a little bit better. And so it is very frustrating, but the way I turn it around and say like, well, this is the only thing, this is the one thing I can try to do, to not just make it better for myself, but make it better for everyone else who has to deal with it. Like that's kind of how I keep myself going, even though it can be really frustrating. And of course, I understand sometimes I need to take a break because one person can only take on so much. But it just feels a lot more empowering sometimes to think of this battle as one that is so much bigger than me. And I feel like I'm doing something where if it weren't for me, I'm not sure who else might, like I'm in such a position of privilege. I can actually try to do something, whereas not that many people are so fortunate or sit at that exact intersection of experiencing this problem and having the skills to try to address it. So that's kind of like my take on the resiliency is like, just keep pushing forward. Sometimes it feels like there's no other choice, but it's also the best choice to try to do something. In terms of advice for others, I guess the first is to know that you're not alone. You're not crazy. You're not imagining things. Don't let people gaslight you into thinking that. I have had people tell me in the past, like, there is no sexism, there is no racism. You're just imagining it and projecting it around you. Don't let people gaslight you into that. Two, I think it is kind of like similar to what I've tried to do, is like figure out the ways in which you have agency and can try to take some control, some measure of control back. It might be things like choosing who you want to engage with, who you want to spend time with, are the people that give you energy, choosing a work environment, if you can, that is more favorable to you and more welcoming. Or it can be even things like trying to get involved with activism and community organizing to try to make things better systemically. But I think exercising that agency can feel very empowering. To feel like you're doing something, even if you are still acknowledging that the system is very broken and needs fixing.
Thank you, Tracy. And Dr. Yang, I want to pull you in as well and hear your thoughts with, how you've engaged with the word resiliency and your advice for others struggling to maintain their own mental health in the face of systemic racism.
I think that people that we often think of as the most resilient rarely see the words, rarely see that as a compliment. Because I think when people speak out about the circumstances through which they have to be resilient, they're often not asking for comments on their own characteristics. I think people want justice. And really, resiliency and the concept of that isn't. I think personally that it's a term that workplaces have used to try to wring out the last few dollars of productivity from workers. And I personally think that many workplace programs that kind of have this agenda, that especially when they don't address like other conditions and the environment in which people have to be resilient. I think on an individual level, we all have to decide what we can accept and what we can tolerate. And if at some point the conditions that we work in or that we see our society, and by that I mean what's happening on your street, I think at some point, if you decide that that's not something you can tolerate, your job is to change it. And I think that goes for each and one of us. And, I think that the more and more I do this work, I realize there is a system, but in many ways, it's an abstract hulking thing that when you break it down, really is not something that exists. There's a collection of things and people around you and the way that in which they do these things and perpetuate systemic racism, but there often are things that you can do in your communities to address it in ways that where it works. It's often, I think, very helpful to think about where you are situated locally. I think that makes things feel less overwhelming. And often we have more control over what happens in our cities and our provinces or states rather than things at an even higher level. But just starting out with knowing your community, knowing what's going on there, feeling connected to there, I think can really help. And I think that, I'm sure the thread of what people will say, and I think for many people, the thing that keeps them going, that keeps them resilient is having that community. And so doing what you can to feel connected to it, with the people who are going to be sharing your similar values, finding that community for yourself and understanding the ways in which all this actually happens at the street level and the place where you live can be so important, because often those are the places that are the easiest to change. And my last piece of advice for people struggling to maintain their own mental health, I just want to echo to get help. Like, if there's one message to send, I think is really important, is that addressing your mental health is not self-indulgent. Therapy is not just a thing for white people. It's important to your survival.
Thank you, Dr. Yang. And Dr. Kelly, I want to give you the opportunity to add in your thoughts as well.
Sorry, I was saying that I believe that there is selective relativism that is often embraced when we talk about resiliency. Oftentimes, major culture and the majority will selectively choose whose experiences are valid. And then there's, on the other side of that, there's a cultural stoicism that is often present when exploring and evaluating the lives of marginalized people. So therefore, it's only the privileged class that are afforded the human experience of pain and trauma and suffering. And the rest are told to keep pushing, it didn't happen, to brush things off and continue with their lives. So, I think resiliency has a place, and I think it can be important, but not at the expense of denying a person's humanity, or not at the expense of a person denying their own humanity, even most importantly. And that, I believe that some people find a lot of strength in, what we say being a boss, right? Of just kind of keeping it pushing. But I also think there can be a lot of strength that is found in recognizing your pain, right? Recognizing that you are affected from living and existing within a systemically racist society.
Thank you, Dr. Kelly. While I would love to continue this conversation, we're unfortunately almost out of time. So I just want to say thank you so much again to you, Dr. Kelly, Dr. Yang, Eric, and Tracy for joining us, and to everyone who tuned in this evening. If you'd like to learn more about PIH, you can head to pih.org or find us on Facebook, Twitter, LinkedIn, Instagram, and most recently, TikTok.
Imagine a world where healthcare is not a privilege, but a human right. Where care is not conditional, but guaranteed. Where no patient is left behind. For more than 30 years, Partners in Health has made it our mission to create this world. From the bedside to the halls of power, we have spoken up when world leaders fell silent, taken a stand when others wouldn't, delivered care once thought impossible, because healthcare can't wait, and neither can justice.